He was born in one of the wealthiest countries in the world. His fellow Australians can expect to live long and healthy lives. But this boy's future is far less bright, simply because he's Aboriginal. In the Northern Territory, Indigenous boys at birth will on average live to just 61 years of age, 18 years less than non-Indigenous Australians. Nationally, life expectancy is a little better for the Indigenous population, but it's clear just how large the gap is between the Aboriginal population and the rest of Australia, at least 12 years. Just over 500,000 Australians are identified as being Indigenous, and proportionately they suffer from ill health at a much greater rate than the rest of the population. A clear relationship has been identified linking poor Indigenous health with poverty, unemployment and a lack of education. This is exacerbated by poor nutrition, substance abuse and inadequate health services.
We know that there's inadequate access to health services. We know that the distribution of health services is not equitable.
Prior to European settlement, diseases such as the flu, measles and tuberculosis didn't exist in Australia. In fact, it's believed Aboriginal people in pre-colonial times were probably in better health than most Europeans. But in the past 200 years or more, the tables have turned, and Indigenous people now suffer badly from European diseases. Take diabetes, which was first diagnosed among Aboriginal people in 1923. Records prior to this time showed they were fit, lean, and did not suffer from any form of metabolic condition. Today, Indigenous people are 3 times more likely than non-Indigenous people to have some form of diabetes. More than a third of Aboriginal people aged over 55 suffer from the disease, while the death rate for the Indigenous population is 7 times that of other Australians. The affliction is in part attributed to poor nutrition. 4 years ago, the government launched an initiative aimed at closing the gap between Indigenous and non-Indigenous health by the year 2030.
We don't pretend that we're going to have all the answers. We're not going to pretend that we're going to produce magical outcomes. But we are determined, absolutely determined, to roll up our sleeves and have a damn good go.
The Northern Territory government claims it's beginning to see an improvement, at least in women's health.
Already we've made some very significant strides. Life expectancy for Aboriginal women has increased by 3 years.
But health workers agree that Australia is still a long way from achieving Indigenous health equality.